and Instagram live both. Yeah. So let us start it. And if you have any questions, do start writing on the chat box so that I can know and I'll be able to answer. Welcome, Dr. Babel, I think. So let us start. And there are some few questions last time which were not answered. So I don't remember the questions. But if you have, do write so that I can start answering those. In the meanwhile, we had a question. So I'll just take that question first and then go to other questions. So there was a question where the student had asked again the same thing, where do you study the mathematics and how do you remember those symptoms? Yeah, I am there on YouTube live also, Dr. Babel. I am there. Welcome, Dr. Alexander, Dr. Ashok, Dr. Chishti, Dr. David Johnny. So again, the same question had come, that how do you remember mathematics and all? So the answer is very simple. Make sure that you study Mathematica every day. Don't try to mug up the symptoms. Remember, don't try to mug up the symptoms. If you try to mug up the symptoms, you can only remember that maybe for some time if your memory is good. But again, back to square one. So make sure that you don't try to mug up the symptoms and study it every day. And every day you'll be surprised. Take it from me that every day a new concept will come to your mind, and it will be such an interesting one, because homeopathy is such an interesting science that every day you feel something new is coming. Hello, Dr. Babal, you are on YouTube live now. Can you talk about Kali cyanide and your clinic experience? Yeah, Kali cyanide, first of all, if you are basically trying to study rare remedies, if you ask me, if Kali cyanide, if I have to ask, I will basically go first with Kali. There will be very less occasions where I would have used only Kali cyanide because I know Kali cyanide. Now, Kali cyanide, there are 2 or 3 things which are very important that you should remember. I have used Kali cyanide in case where I have seen that throat complaints of Kali cyanide. If you see the mathematics of throat complaints of Kali cyanide, they are very, very peculiar. For example, if you want to prescribe Kali cyanide, the first thing, can you tell me something about Kali? Then I'll be able to answer you better. Anybody? Kali, I have told you in my I think bimental meeting also, Dr. Alexander. So if you understand Kali cyanide would be very easy. Of course, it's cyanide, so it's a poison. Yes. Otherwise, when I start speaking about some mathematics, it will keep on and on. So Kali cyanide related to Kali, and tell me something about Kali so that it will be easy for me to tell you about Kali cyanide. Okay, if you don't get Kali cyanide I have used where, see, in Kali cyanide one thing is very important. It is potassium cyanide, and whenever you have to dull, dutiful and sense of responsibilities. Okay. Overstretched back fins. Yeah, very nice. Weakness. Yeah. So Kali cyanide, one of the very important symptoms, local symptom of Kali cyanide is cancer of tongue, and there is agonizing neuralgia, which is the 3 marking of that drug. Kali cyanide mein the important thing is neuralgia and agonizing cancer of tongue and agonizing neuralgia. Kali is, remember, it is overstretching of the mind. I've explained you before also. Second thing, in Kali cyanide, one thing is very important. The severe neuralgic pain is in the temporal region, and it recurs daily at the same hour. Few cases of trigeminal neuralgia, if the modalities match, then Kali cyanide will work very nice. Third, in Kali cyanide, cough is there which prevents the sleep, and the patient cannot take deep breath. So it is he cannot go deep inside. And remember the modality of Kali cyanide, 4 a.m. to 4 p.m. This is, of course, with the Kali's overstretching of Kali's is something which you must see. Kali is anxious about others. Yes, Dr. Ruhi, welcome. Dr. Tamanna, Dr. Tanveer, Yeah. Chest pain after pulpus vigorous exercise, remedy for it. Yeah, simple as that. I told you before also, calcarea cup, you must think about it. And like weakness. So this is Kali cup, overstretching from fainting also there. So this is something about Kali cup that you should, that I remember. Of course, there may be a lot of other symptoms of Kali cup, but this is basically Kali cup, which I know. And remember Kali cyanide, sorry, with that neuralgia pain, temporal region, cancer of tongue, and cough prevents the sleep. These are the four important things. Of course, club it with the main symptoms of Kali. Dr. Wasim, Dr. Welcome. Yeah, I hope you could get some of the answers with Kali cyanide, Dr. Alexander. Let us go further. Any other question? You can take neuralgia for Kali cyanide would be, it could be also for orbital neuralgia or submaxillar neuralgia, anything Kali cyanide would work. But the modality 4 a.m. to 4 p.m. is also very important. Eczema treatment done after steroids, which remedy to give? See, if the patient has eczema, and most of the cases of eczema that come to us basically they come after either local applications of steroids or taking that. Now, if you are fixed that I want to take out the what you call symptoms of steroids by using Nux vomica, it may or it may not work. But if you select a constitutional medicine, it will work. So in my case, if you ask me, every time Nux vomica does not antidote, but a constitutional remedy will antidote also and give rise and cure the case also. So it's that important. Uh, Dr. Verma, yeah. Hello, sir. Hello, Dr. Verma. Amit, good afternoon. Yeah. This is okay. Kali cyanide. Dr. Zakira, welcome. I hope you understood something about eczema. A lot of people ask me whether to give Nux vomica or antidote with camphor. Previously, I used to do that, but it is for only our satisfaction. Most of the time, I've seen if your remedy is right, if the constitutional prescription is right, it would cure the case. I still remember a case of Bovista where the whole skin had a tether eruptions, itching, and exfoliation. Taken a lot of steroids for years, I gave him Bovista 200 single dose. After 3 days, he was 80% better. So if your constitutional prescription is right, then it will work if without being antidoted by Nux vomica or other drugs, what you're thinking about. So go for constitutional prescription. Any specific remedy for worms in children except Sina? Yeah, I had told you a lot of remedies for worms. For Sina, you can think about Sina, think about Chilon, think about Centonine. These are very, very common remedies to think about. Or these are the remedies you think about. You can think something, you can think other remedies also, but these are the very basic remedies that come to your mind, and it will work. It will. Chilon and Centonine are very, very important remedies, and it works wonderfully. And of course, if there are hookworm disease, then you can think of a very rare remedy which I have used for hookworm especially, that is thymol, Thymol. In this case, you can use, if it's very specific, thymol is a very interesting remedy. Go home and read thymol, it will cure a lot of cases, And if you are prescribing Sina, remember one thing in Sina, there is a lot of weakness with worms. Then Sina is Spagula is also there. A lot of remedies are there. But if we are taking about some specific remedies, you must think about these remedies, 3-4 remedies, which are very, very important. Of course, Sina is there, but it is weakness with that. Now you can see there are remedies like Teucrium marum venom is there, Natrum mur is there, Sabardella is there, in children Natrum fos is there, Spigilla is there, Ignitia is there, Calcarea is there, and if you go to see the maternity, there is one bowel nosode also, it is I think Gantner bacillus, Gaetner bacillus. It's a bowel nosode. And then if you see, then you must see what is the symptom because of worms. For example, thymol. Thymol 30 will do for it. For example, worms causes headache. Then you can think of Spinacina, Calcarea. Worms causes itching. Then you can think of Sina, Sabardella, Teucrium. Worms causes eye complaints. Then you can think about Sina, Artemisia vulgaris. So there are other permutation combinations also if you go to in depth of this worms complaints. I hope it is very clear, sir. Any medicine for white spots in children's? Again, white spots, Dr. Tanvir, what are you telling? I don't know. It's vitiligo or it is just pityriasis alba. So it's very common and you can treat that for vitiligo. Of course, it's a one-sided disease, so case taking is very important, Homeopathic clinic, welcome. So I hope you understood that. And vitiligo, treating vitiligo is basically very, what do you call it? The difficult also, one-sided disease, difficult to get the symptoms, but of late having good results with vitiligo. Do go for the whole case. Don't set some wrong notions in your head that in vitiligo you have to ask this, ask this, ask this. It's basically a chronic complaints. Go for the syphilitic miasm. Whatever syphilitic miasm you can see in that case taken, that's a prescription entry point. Welcome, Birwala. Amit, yeah. Insistent, interesting was your case of dialysis with worms. Yeah. Thank you, Dr. Babel. Patient 35 years, tired and weakness after traveling. Weakness, cough starts from larynx, dry cough, evening aggravation, no thirst, frustrated, must work, sick for 7 days, says no energy at all. No energy. See, whenever you have complaints, where there is weakness and you are specifically telling no energy at all, if you are telling basically weakness because of cough complaint, then it's a very very common thing you have. No, you can go to the maternity and you have so many remedies. Weakness, excessive weakness because of cough complaints. Anyone can guess? Cough causes weakness. So you must think about 3-4 remedies, Dr. Madan. You must think about arsenic album because it's an acid. Think about veratrum, think about oleum jack, think about ferrum metallicum, and think about China. No, vitiligo. Yeah, vitiligo, Dr. Tanvi, that's what I'm telling you. One-sided disease. Be very flexible in your case taking. Remember what Dr. Hahnemann has said in aphorism number 6. Go home again, read the aphorism again. You'll get a very beautiful idea about case taking. And in this case, it is a syphilitic miasm, out and out syphilitic miasm. Make sure in your case taking, however big is your case, however hours you take for case taking, you must have some syphilitic symptom in order to prescribe in a case of vitiligo because it's a syphilitic disease. Which remedy software would you recommend based on experience? Cara or complete repertory. Stellum metallicum, okay. Kali carb. Sir, Kali carb weakness is something weakness. So Kali carb is a very important remedy when you're overstretching mentally. And when you stretch over mentally, sometimes you get fatigued and exhausted. That is the weakness where Kali carb starts. Sir, I have a patient who passes flatters very less and sometimes only while passing stools. That's absolutely fine. The fermentation in the abdomen is not so much, so it's absolutely fine. There is no need. There is no remedy where you can give and the patient starts passing flatters more. So no need to prescribe, I feel. Dr. Vaishnav, good afternoon. Amit, yeah, Kali carb, I just told you. Dr. Motwani, welcome. Stellum metallicum is also antidote for worms. Yes, it is there. But we are talking about some specific medicine. That's why I told you about Chilone, Centonine, Senna, or Spigelia. Yes, Dr. Sparkling Samir. Very nice name. So, Dr. Madan, if you want to increase your area of prescription, so you can see weakness in acute disease. That includes everything. So you have a wide range of prescribing then. Then you can think about remedies like China Rs, Cocculus, Phosphorus, Caliphos, Acid Phos, lot of remedies. Tumor on upper jaw, the upper teeth are getting apart, painless. Tumor of right breast, painless. Feels like a knotty mass on palpitation. Chokes and gaps after drinking water, but perfect. Was swallowing solid. No thirst, chili types. When swallowing solids. Yeah, so whenever you have this word, solid is more painful and liquid is more painful. So your mathematica becomes very easy to understand, when the patient says whenever you're swallowing solid and there is aggravation and you have a specific symptom where the patient is chilly and thirstless type. So it's a very interesting case. Everything is given in the symptom, and when we repeat the case, there are 3-4 remedies that will come to our prescription. It is C, painless. Now you must see there are 3 remedies very very important. Of course, I'll name what I feel is important. The first is Laccan, second is Kali carb, third is Carboveg. But in this case, there is a remedy that you should think about, though it is rare. But important in your case, that is physostigma. Do think about physostigma also. So these four remedies I think should solve the case, or it means entry point. All the remedies are chilly and all the remedies are thirstless with painless tumor. So also think about physostigma in with leccan, calicarb, carbovage. Uh, Scope of homeopathy in varicose vein, I have already discussed that before YouTube. It is definitely good. We can definitely stop the progress of disease, and those veins which are reddish and very tortuous will become less threatening, and the color will also change. Welcome Dr. Mona, Dr. Sheetal, Dr. 16 years old, she wants to be the best at school and the best at dancing. If the teacher says the other person is good and she gets very angry and she wants them to die, and then she will be happy. Oh, and I have a lot of, we have a lot of cases and all, now whatever I have seen, this patient are very egoistic. This patient are, they keep on to bowling their own trumpet. But I'll tell you one thing. These persons are very narrow minded. They do not accept, they do not feel that others person can be better than them. Their way of action, their thinking process is very narrow minded. Do think about Brata carb, do think about ammonium carb, do think about conium. I have found very good results in these cases. Okay. Glaucoma remedies. Thank you, Alexandra. I hope you get some results with that, doctor. That was a good case, and do share the case if you get some good results. Yeah, Dr. Venkat, welcome. So, glaucoma remedies. See, whenever you are treating glaucoma, of course, I will tell you the remedies, but see, these are all chronic disease. These are all because of accumulation. The fluid cannot pass through the channel. That's why there's symptoms of glaucoma. There was a very interesting case in my OPD. The patient had glaucoma. There was a lot of obstruction, and the patient used to feel that my eye has become so large. Sir, see, my eye has become so large. That was the only symptom I took for prescription, and that gave me fantastic results, And the remedy which I gave to the patient was Comolcadia, Comocladia, dentata. It is called as guao, Guao, where the patient feels because of glaucoma, the eyes become very large. Other remedies for glaucoma, generalized, I can tell you, it is phosphorus, it is kali iode. I think physostigma is also there, nitric acid and spigelia, which I can think about. Dr. Ananya, welcome. Please guide, sir, when we have to give consultative medicine and medicine on pathological condition exist both. No, see, if you are very well versed with the case, for example, if the patient has come to you with severe migraine, and there is a very peculiar symptom of migraine, okay, whenever there is headache, whenever there is migraine, the patient starts spitting. I think I have told this in my webinars of migraine. The patient starts spitting saliva because of migraine. Anybody can guess the remedy? I think those who were there in my migraine seminars, don't tell me you forgot. Spitting because of headache. Anybody? So these are very peculiar symptoms that defines the patient's local symptom. The remedy is epiphagus. So in those cases, give the remedy, acute remedy first, because it is the surface miasm which is showing you. Patient will be better. If the patient gets attacked, recurrent attack, sometimes epiphagus might cure the case. If the patient gets an attack, then take the whole case and give the no, not belladonna, Dr. Madan. You were not there in that seminar. That's why. So then you take a constitutional remedy and then prescribe. So if there's acute totality is there, it is defining totality, give that remedy to the patient. In migraine, in headache, there is a very, very typical symptom of belladonna. In migraine, there is a very, very typical symptom of belladonna. And what is that? Anybody who was there on my webinar? Yes. So whenever you have belladonna, yeah, epiphagus, yeah, Dr. Alexandra, we have got the answer. Calcarea carb is also there, but calcarea carb means spitting is because of anger. In epiphagus, it is because of headache. In belladonna, the most important symptom is, apart from the throbbing headache, the congestion and all, make sure Mr. Getting it done. Welcome. So Dr. Madan says, could you think of 16-year-old girl jealousy? Yes, Definitely, why not? Do think about that. See, that's the beauty of homeopathy, You can get anything anytime. You can get anything anytime. So make sure that you be very open. That's why I always say aphorism number 6. For once in homeopathy, just be very plain, just be very, very simple. It's a very simple science. Read aphorism number 6, take the case, what the patient has told you, repetize it, see the miasm, what is there, prescribe, and you'll get results. Forget whatever you have learned from whatever. Be very simple and you will definitely get good results. I am also having the same thing, just being very plain, what Hahnemann has told, take the case, and that's the remedy. Okay. So I hope everybody tries to be very simple. It's a simple science. Don't complicate it with other things in homeopathy. Good afternoon, Dr. Sasdeva. So I was just telling about belladonna. How is the belladonna better? I think those who were there in the seminar should get the answer. A belladonna patient modality. If you open, see migraine, if you open the books of physiology and medicine, it is written the migraine has throbbing headache, pulsating headache, redness of the eyes, vomiting. These becomes all normal symptoms, Okay, you think, and maybe in the next YouTube you must give the answer. Belladonna patient modality. Castoreum, very nice, Dr. Ruhi. It is a very rare remedy. That remedy also has spitting. So can we have some other question? Glaucoma, I think we have finished. Glaucoma, I think we have answered. I'm sorry, not finished. So if you go further, anything you can remember of the case? Swishing sensation of water in the head, emulsion dark room, removed from lights. Yeah, it is there. Migraine patient, most of them wants dark room, wants to sleep, wants to tie the head with the tourniquet. It is there. But I think few doctors who were there in the seminar of migraine should answer. Belladonna, hyperhidrosis, yes, Santosh, we can definitely treat that complaints if it is out of control. So I think that's the homework for belladonna. Keep guessing and give me the answer after some time. Yeah, so as we go further, we have just done, I think, glaucoma. Everybody has seen the answer of glaucoma. I hope you understood that the remedy which you told, it was very, very rare. And I hope you are lucky to get this type of symptoms in your practice. And then you'll appreciate some of the very infrequently used remedies. They give fantastic results, simple homeopathy, that's what I stand for. Simple homeopathy, simple case taking, aphorism sick, and the case taking part of case taking of organ of medicine. You'll be able to crack the case, and the miasms, very, very important. So I think I gave sulfur LM potency 30, patient is better, but still the problem is there. What to do next? Sulfur LM till 30 you have finished LM 30, or you started with LM 30? Till now I have never in my life, I have never gone in few only cases I have gone beyond LM, I think 16. I have never gone beyond LM 16 till mid. So sulfur LM 30, I am surprised. If you are going basically by gradually increasing the potency, if it is not working till 10, 12, 15, I think the remedy is wrong. Then you should change the remedy, because it is only partial simillimum. Sometimes what happens, it's a partial simillimum, then it can be a salt of sulfur. Calcareous sulf, natrum sulf, max sulf, it's like that. So it must be a remedy close to sulfur, but not sulfur. So it must be one of the salts of sulfur. So do take the case, and then if you find some other symptoms, you can add a salt of sulfur, and then you'll get better results. Yes, so I hope I'm clear of what I am talking. Any questions? I think on Insta there was a question, but they have scrolled up because there were a lot of students who were joining. So I was just naming them. Started with LM2. Oh, if you start with LM2 and you have reached LM30 and the patient is still not better, it has to be a salt of sulfur. So please, 2 till 30 is a long process, till it I think till 8, 9, if you started with 2, I think with 4, 5, you must get some satisfactory results, and the results should keep growing, because I have seen in lot many of cases when I reach LM maybe 10 or 11, already have started tapering the dose, maybe once a week or once in 15 days. So just think about the case, just retake the case. It might be a salt of sulfur because your sulfur is working. It's not that it's not working, but it's very close to sulfur, but not sulfur. Yeah, so as we go further, glaucoma, I think you must have understood. Can we go further? See, there was an interesting case where the patient suffered from eyes. I'll just complete one of the case. Heaviness of the eyes. Patient says heaviness of the eyes, especially heaviness of the lid. Yeah. Dr. Alison, something to do with the position. Very right. You are very close, so I think you should be able to answer it. So just telling you a case where the patient used to get up in the morning and say that, yeah, the patient is better, but totally still not cured. No, so still 30 you have reached more, so it might be a salt of sulfur. So when he gets up in the morning, he says my eyes become very heavy, especially my eyelids are very heavy. And of course, whenever we have that eyes heaviness and all, I also first prescribed gelsemium, did not work. A very, very interesting remedy. Of course, I added one of the symptoms of that remedy. I gave the patient a very, very infrequently used medicines. Of course, not a rare remedy, but infrequently used medicine. That is Daphne indica. It is DAPHNE indica, and that cured the case. So sometimes that symptom has to define the patient, and then you can get good results in those cases. Patient is better, but not cured. No, that's what I was telling Dr. Sachdeva. Dr. Samruddhi Ghazal Mulchandani, welcome. So I think people are joining when it's time to leave. I think it's already half an hour now. So something to do with the positions of belladonna, very nice. You're very close, and I think you should again go and read some books, and you'll be able to get the answer. But I think you are there in the 7 of migraine. I am surprised that you can't get the answer. Do get the answer, because it requires a lot of studies of Mathematics and books, and then basically I prepare for a seminar, so it takes a long study material. So if I'm happy if that you can reproduce what I've given you, so that you can get good results also. So I think that's all for today. I think nice talking to you all, and thank you for all your questions. I loved answering them, and I hope you also like it as much as I like answering you all. So thank you everybody. Thank you for joining. Until next time, meet you again on Insta and YouTube Live. Thank you.